Hey guys, I'm David DeMuzio.
And I'm Steve Cook.
This is Hair Loss Hope, and today we're going to tell you some things that you probably don't know, but they are extremely important if you are an African American patient who is a female and you're experiencing traction alopecia. Take it away.
The African American female that experiences hair loss for the most part is a result of braiding their hair, putting in hair extensions which are tightly pulled together. I mean, the tighter they are, the longer they stay in. And this is part of, their fashion, which looks awesome. And what it does, unfortunately, is put tension on the hair that is referred to in the industry as traction alopecia. Now, traction alopecia is an issue, obviously, because alopecia is an issue, which means you have hair loss. So there's good news and there's bad news. The good news is that for the most part, for the most of the patients, the traction alopecia patient doesn't have genetic pattern hair loss, which is androgenic alopecia. So that means that it's kind of constrained into an area in a specific zone. And if they are good hair transplant candidates for all the reasons that we will discuss, they can be very successful. The bad news is they have traction alopecia. So what I recently saw, which I had never seen before, was a female patient, African American, that came in with what to me looked like traction alopecia. Now, please understand, as you well know, I'm not a doctor and I don't give any medical advice. But what happened was it looked so much like traction alopecia that when she spoke with the doctor, he had asked her certain questions about, and she hadn't braided her hair in a long time. So that was kind of just kind of a red flag. But to me, and I'm looking at patients for 25, 30, 35 years, this was absolutely African American female traction alopecia. So we sent her to a well-known dermatologist that does his own pathology and had a biopsy done. And lo and behold, it came back as a scarring alopecia. Now, here's where this gets kind of technical, but it's very important to understand. If an African American female who goes into a hair transplant clinic, usually, most of the time, as long as I've been around, a doctor's going to look at this particular female and say, oh, that's traction alopecia. And then they're going to offer to do a hair transplant. Well, guess what? If it's not traction alopecia and it's scarring alopecia, the hair is not going to grow. This is a disaster. This is a potential catastrophe because if your hair transplant surgeon is not ordering a biopsy and you have scarring alopecia instead of traction alopecia, the hair is not going to grow. You're going to pay all this money. Of course, you're going to sign disclaimer disclosures that there's always a potential that the hair might not grow, but nobody knows that it's not diagnosed as scarring alopecia. So this is a big concern, especially to David and I. We want to bring the education to the viewer to make sure you're aware of what's going on out there. There's nobody's fault, but my advice would be to all female African American patients that have what looks like traction alopecia to make sure 100% of the time you get a biopsy done by a reputable dermatologist that knows who's doing the pathology so you can make sure before you go under the knife and have a hair transplant.